Chronic kidney disease is defined as the irreversible and gradual loss of kidney function over time. Your kidneys are responsible for filtering waste and excess fluids from your blood, so damage to these organs would result in a dangerous level of fluid and buildup of waste in the body. Initially, individuals with chronic kidney disease do not show any specific symptoms, but as kidney function deteriorates, toxins and waste will build up. This may lead to high blood pressure, cardiovascular problems, peripheral and pulmonary edema, lowered platelet counts, and other serious symptoms. A prominent cause of chronic kidney disease is a condition called renal dysplasia. Renal dysplasia refers to the abnormal development of renal tissue elements rendering the kidney non-functional. Dysplastic kidneys may be larger or smaller than normal kidneys, and some may even contain fluid-filled sacs called cysts. In the United States, about 1 in every 2,400 babies are affected with renal dysplasia. If both kidneys are affected by the malformation in the developmental stage, the fetus generally does not survive the pregnancy. Those that do survive must require severe treatment options very early in infancy. If one kidney is affected, however, the baby can grow up normally with few or no associated health problems. Problems only arise when the potential of urinary tract issues affect the other kidney as well. So what causes renal dysplasia? It is thought to be caused by genetic factors and/or by medicinal or recreational drugs taken by the mother during pregnancy. And what actually happens in the kidneys during development to cause the defects seen in renal dysplasia? Kidney development is guided by two processes, morphogenesis and nephrogenesis. Morphogenesis is the process where the organism takes shape, while nephrogenesis refers specifically to the development of the kidney's functional units, the nephrons. To describe the normal development of a kidney, we like to use a specialized analogy. Picture a verdant meadow and a tree growing from the ground. The tree grows normally and branches out in a healthy manner, producing large bushels of leaves that can photosynthesize and carry out normal function. This is analogous to the development of the kidney, and the branching process is similar to morphogenesis, where the kidney's internal network of tubes takes shape. The leaves represent structures in the kidney called nephrons, which are responsible for filtering our blood. Now, what if the kidney develops abnormally? Let's use the same analogy of the tree, but this time the surroundings are not optimal and it does not develop fully. Branching becomes hindered, and this results in a sickly tree with a malformed shape. If the same happens in the kidney and branching anomalies occur during development or morphogenesis, the kidney takes on an abnormal formation and cannot function properly. So what treatment options are available? Current options include dialysis, a process by which waste is removed from the blood through a filtration machine. In more severe cases, a kidney transplant may be needed. However, the likelihood of finding a donor can be difficult, and post-surgical complications are likely to occur. Both options can be emotionally stressing for the patients and their families. Aside from invasive treatments, there are no other viable alternatives. Other treatment options, specifically a medicinal drug, have yet to be discovered. Research on the molecular pathways of this renal impairment is needed to determine drug targets that could block these adverse effects from developing in the kidney. That is why Dr. Darren Bridgewater from McMaster University is keenly interested in understanding the molecular pathways involved in normal and dysplastic kidney development. He hopes that by understanding these pathways, he will be able to identify potential drug targets that can help treat and prevent renal dysplasia. Dr. Bridgewater tackles the problem of kidney disease by using a three-pronged approach. Firstly, as mentioned above, he does basic lab research to gain a better understanding of what happens during normal and abnormal kidney development. To this end, a major focus of his lab is on elucidating the role of a transcription factor known as beta-catenin in normal and dysplastic kidney development. As a short-term initiative to help patients with chronic kidney disease, Dr. Bridgewater trains doctors in peritoneal dialysis catheter insertion under a teaching program offered to nephrology fellows across Ontario. Lastly, Dr. Bridgewater is heavily involved in training the next generation of physicians, as he is a regional anatomy coordinator at McMaster Medical School. His training philosophy encompasses a holistic understanding of gross anatomy and pathoanatomy. For more information on his research, please visit Dr. Darren Bridgewater's research page under the Department of Pathology and Molecular Medicine at McMaster University.